this session here. So hi, everybody. Welcome. It's nice to see a lot of familiar faces here. I'm really excited about our topic today and our guest presenters. So today we have sharing with us Joshua Dennis and Jean Back with Schwabe, Williamson, and Wyatt. Jean is actually a board member here at OMEP, and she is a shareholder at Schwabe, Williamson, and Wyatt. And Josh is an associate attorney specialist with OSHA compliance. That's kind of his area of focus among others. And they're going to talk today about some of the new COVID-19 updates for manufacturers. This is a really timely topic and something that I think you're going to find really useful, because if you're anything like me and you tried to read through some of the new guidelines, there's just like mountains of text and it's pretty hard to make sense of it all. So Joshua and Jean are going to help us to do that. With that, I will let one of them take it from here.
Can I just ask people to mute their phones if they're not actually speaking? Might help. There's some background noise. And I'll let Josh.
All right. Yeah, thanks, Jean. If you can go to that first slide, Jasmine, I really appreciate it. As Jasmine mentioned, this is a very timely presentation. I gave a similar presentation last week before we had the final rules from Oregon OSHA, but around 6 p.m. on Friday, Oregon OSHA issued the final version of its COVID-19 temporary standard that can be found on their website. You can Google Oregon OSHA COVID-19 and it'll take you to their main page. So I encourage everybody to take a look at that if you haven't done so already. This presentation, it's quick, but I'm going to try and run through each of the requirements under the temporary standards, give you an overview of what you'll expect in those standards, and then if you have any specific questions, feel free to give myself or Jean a call, and we'd be happy to dig into those a little bit further with you. So I want to talk quickly about kind of where we are in terms of the temporary standards. They were issued on last Friday, right? And then they're expected to become effective on November 16th, and they will remain in place until May 10th of next year. In the meantime, Oregon OSHA has already indicated that they're working on permanent infectious disease rules, so be on the lookout for those as well. So you can go to that first slide, or the next slide. Who do these rules apply to? So if you work in Oregon, they apply to you most likely. In the rule, it says it applies to all workplaces and workers subject to Oregon OSHA's jurisdiction. Unless you do work on a military base or in tribal lands, you're likely covered by Oregon OSHA's jurisdiction. So these rules will apply to you. Next slide. So which rules apply to your company? So if you look at the rules, they're broken down into two categories. The first category is everybody except workplaces at exceptional risk, and the second category is workplaces at exceptional risk. So how do you know if your workplace is at exceptional risk? Again, for most, if not all of the folks on this call, in this webinar, you're likely in that first category of everybody except workplaces at exceptional risk. The exceptional risk category mainly applies to healthcare workers, environmental decontamination companies, that sort of thing. If you suspect that you might fall under that category, take a close look at that exceptional risk definition. And if you do fall under that category, you want to take a look at those specific requirements for exceptional risk workplaces, which we'll not be covering today. So next slide. First requirement that I want to talk about, and you know, it's not surprising that some of these requirements are in the new temporary standards. It's likely that your company has been implementing some of these practices in some form for many months now. So the first one is physical distancing. It states that all employers must ensure that both work activities and workflow are designed to eliminate the need for any employee to be within 6 feet of another, unless the employer determines and can demonstrate that such physical distancing is not feasible for certain activities. So jumping into that real quick, there's a couple things to point out. It says work activities and workflow. must be designed to eliminate the need for employees to come within 6 feet of another individual. So work activities we would typically understand to be, the employee's main job duties in the workplace, and workflow is how employees or other individuals move within a workspace, whether it be a common area, hallways, bathrooms. You as the employer need to be mindful of how that workflow occurs and take steps to eliminate the need for an employee to come within 6 feet of another individual. And that says another individual, not another employee. So if they come into contact with folks from the public or other third parties, you'll want to be mindful of that as well. The last piece is the feasibility. Feasible is defined in the rules, and it's a pretty high standard to show that something isn't feasible. And even if something isn't feasible, you still need to take other steps to protect employees from COVID-19 exposure. So next slide. The next requirement relates to masks, face coverings, or face shields. It states that each employer must ensure that all individuals at the workplace or other premises subject to the employer's control wear a mask, face covering, or face shield. The rule specifically allows for face shields, but they strongly recommend that employees and individuals wear masks or other face coverings. Again, this says that employers are responsible for all individuals at the workplace, not just employees. That means, if there's vendors or folks from the public coming into the workplace, you are responsible for requiring those individuals to wear a mask, face covering, or face shield. They must be provided at no cost to an employee. A question that comes up pretty often is, what if an employee refuses to wear a mask? If they refuse to wear a mask, my advice to employers is to treat it like any other piece of PPE, and how you would treat an employee that refuses to wear their hard hat or a safety vest or correct footwear. It's a violation of the safety rule, and there should be appropriate discipline and potentially removing that person from the workplace if it's unsafe. So the next question is,
can I ask you a couple of questions that I have, so maybe other people do as well?
Sure.
After these two slides? Well, first of all, the workflow. So would, for instance, having, if you're able to, having people go one way down hallways and one way, down a different hallway, I don't know if that's feasible, but it's kind of like grocery stores are doing.
Yep, exactly. If it's one way down the hallway, or if it's some sort of alert at the front door of a bathroom telling other employees that somebody's in there and to wait outside until they're done, like a light or something like that.
Or even
like that.
In use or something like that.
Exactly.
What if, so I listened in on a lot of the calls with OSHA when they were looking at promulgating these rules, and my recollection was that really they want people to wear both a face shield and a mask, and that their strong feeling is that face shields alone are not sufficient, because aerosols can get in under the face shield. It really doesn't do anything but cover your eyes, and not even very well.
Yeah.
Is that what, do you have to use both, or what's the situation?
You don't have to use both. I can't recall if there's a strong recommendation to use both. Jean, you might be right, because there are notes within the rule about what they recommend versus what they require. You're not required to wear both, and they do allow for use of face shields, but it's strongly recommended that you use a face mask or a face covering. So to answer your question, and then this is a kind of a Jean related question, but a question that comes up is medically exempt. What if an employee is medically exempt from wearing a mask? What do you do as an employer? Well, the OSHA rules actually have some guidance for that, and their guidance is that the answer to that question is not allowing an employee to wear a mask. You can't, if an employee comes with a valid medical exemption, you can't say, well, you don't have to wear a mask. That's not an option. There needs to be you need to engage in some other interactive process with the employee to come up with a solution to their medical exemption.
Up to including not having them report to work if they absolutely can't wear a mask, right?
Yeah. There are some exceptions to the rule. I gave this presentation last week, so my slides are a little bit outdated because these rules have been evolving quickly. But the face mask, face shield requirements in the Oregon OSHA final rule, they relate back to the Oregon Health Authority's guidance on face shields and face masks. And those are not the most clearly written rules or guidance that we would hope to have at this point. It basically says, it says two things that are a complete opposite in my mind. It says that employees that are able to maintain 6 feet of physical distancing aren't required to wear a mask. And at the same time, it also says that employees are required to wear a mask at all times indoors unless they're in a private individual workspace not shared with other people. So private individual workspace is not defined. So you have this issue of, well, what if an employee is at their private desk in another enclosed area with another employee, but that other employee is 6 feet away? Is that a private individual workspace? Well, unfortunately, we don't have any guidance from either OHA or Oregon OSHA about how we answer that question.
Well, but on top of that, you've got to overlay the governor's new, as of like Friday, I guess, pause order for I think 9 counties now in Oregon, that because the numbers have gone up so high for COVID cases, that I believe that indoors you have to wear, the governor is saying you have to wear a mask. So yeah. I guess if it were me, I would have my employees wear a mask.
Yeah, and that's what I would recommend too. If they're indoors in an enclosed workplace, in an area that they're shared with others, I would require them to wear a mask. Again, from the Oregon OSHA perspective, and what I try and advise employers to do is look at this as like any other hazard in the workplace, right? And based on what we know about COVID-19, how it's transmitted, if you have the situation where you have 2 employees working in the same space, but they're 6 feet apart, maybe technically under the rules, you could read it to not require wearing a mask, but based on what we know, the hazard of COVID-19 being transmitted through the air, absent any other mitigating steps that you've taken as a company, I would highly recommend that employee be wearing a mask in that type of situation.
And we've got, this is the manufacturing forum. So in manufacturing environments, a lot of times you're in a very large open room, and people maybe do have workstations that are more than 6 feet apart. For those individuals, does the OSHA still require them to wear masks, even say they're 30 feet apart at different workstations?
So again, the Oregon OSHA rules they reference the OHA guidance, and as I read the OHA guidance, you wouldn't be required to wear a mask in that situation.
But if you're leaving your station and walking to another area where you may pass within 6 feet of somebody else, then you would be required to wear a mask.
Yeah, that's correct. So what about outdoors? If you're outdoors and employees are unable to maintain 6 feet of physical distancing, then they're required to wear a mask. If you're in a vehicle with another employee not of the same household, you're also required to wear a mask. There's also exceptions for children under the age of 2, under the age of 12. There's guidance, eating, sleeping, and other. And then it also gives some examples of when wearing a mask is not feasible, but that example is when you're like commercial diving or swimming or something like that. So that's kind of, when we're looking at feasibility, those are the things that Oregon OSHA has in mind. Okay, next slide. And I'll run through some of these pretty quickly. The rules have requirements related to sanitation of all common area, shared equipment, and high-touch surfaces. Each of those terms is defined under the rules. So if you are confused, have any concerns about your particular area that you need to sanitize, make sure you look at those definitions. It also has requirements for how often an area needs to be cleaned, and that those requirements depend on how often or how long a particular area is occupied by an employee. And it also has requirements for sanitizing an area where an employee who tested positive worked. So take a close look at those. Next slide. There's requirements related to posting of the COVID-19 hazards poster, which can also be found on Oregon OSHA's COVID-19 webpage. That was published on Friday evening along with the new rules. If you have employees that work remotely, you are required to email a copy of the poster to those employees so that they have it. The poster, again, most folks on this call know where and how to post these types of this type of information, but it is in a common area and a conspicuous location where employees can easily see it. Next slide. There are requirements for building operators, and the deadline by which you must come into compliance with these rules are a little different than what's on the slide. But so for building operators, by November 23rd is what the rules state. Employers who operate or otherwise control buildings where the employees of other employers must work, they must ensure that the sanitation requirements are met, and then they must post signs in areas where mask, face coverings, or face shields are required. If you do fall under this category of employers, the OHA face covering, face shield, mask sign that they've published is sufficient according to Oregon OSHA for posting. So you can find that on OHA's website. Next slide. There's requirements for ventilation, and these requirements must be complied with by January 6th under the rule. And it says that an employer must maximize the amount of outside air circulated through its existing HVAC system to the extent the system is capable of doing so whenever there are employees in the workplace. So a couple of things about this specific rule. You do not need to install an HVAC system if one doesn't currently exist, and you do not need to upgrade your existing HVAC system. It only applies to existing HVAC systems and maximizing the amount of air when the outside air is not at a dangerous level. So, for example, when we had the wildfires, the rule says that if, with that unhealthy air outside, they don't want you circulating that back into the workplace. So, it does also include some additional HVAC maintenance requirements related to making sure that the HVAC system is working properly. The filters are regularly changed and everything is cleaned out so that it can work properly. The next requirement relates to an exposure risk assessment, and this must be completed no later than December 7th. It applies to everybody, and it requires that a COVID-19 exposure risk assessment be conducted by the employer. And it says without regard to the use of personal protective equipment, masks, face coverings, or face shields. So when you go into the rules, you'll see it gives the specific questions that you're required to kind of ask as a company as part of the assessment. And in answering those questions, you need to answer them without regard to whether or not an employee can wear a mask. So for example, it asks about physical barriers and kind of traffic control and workflow issues. Analyze that, and the answer can't just be, well, employees are all wearing a mask, so we don't have to worry about that. You need to actually consider the potential exposure absent the wearing of a mask or a face covering. The exposure risk assessment must be written down if there are more than 10 you have more than 10 employees statewide. And if you go on Oregon OSHA's COVID-19 webpage, there's an example, a Word document that Oregon OSHA actually prepared for you to kind of just fill out as you go through this risk assessment. So they try to make it as easy as possible. One thing I will point out as you're going through the risk assessment, it asks a lot of questions, but the answer does not always trigger a new requirement. And what do I mean by that is, for example, it asks about HEPA filters and air filtration and what you as an employer are doing in that regard to protect employees from exposure. But it asks about that for you to consider it, but it doesn't, the rules don't necessarily require that you install air filtration or go out and buy air purifiers for the workplace. It just says, it asks you to consider it and potentially look into it, but it's not a requirement. Next slide. The next requirement is to develop an infection control plan. That must be done by December 7th as well. Again, it applies to everybody, and it must be written down if there are more than 10 employees statewide. The rules specifically provide the minimum elements of the infection control plan, so you can look at those rules to make sure that you're meeting the requirements. If you have, and this next point I'm about to make applies both to the infection control plan and the exposure risk assessment. But if you have multiple facilities that are substantially similar, the infection control plan may be developed by facility type rather than site by site. But if there's site-specific information that it would affect an employee's exposure risk, then that must be included in the plan as well. Next slide. There are requirements for employee information and training, and this slide says no later than 6 weeks, but I don't have that exact timeline written down. Let me pull it up here real quick to see when that must be completed by. No later than December 21st is when the employee information and training requirements must be met. It includes a list of topics that training and information must be provided on, and it also states that employers must provide an opportunity for employee feedback. So what that means is you as an employer cannot just give an employee either a handbook or show them a video, and that wouldn't necessarily comply with the rule, because there also needs to be an opportunity for those employees to provide feedback on the steps that the employer is taking to protect them from COVID-19. Next slide. There's also requirements related to the infection notification process. So it states that an employer must establish a process to notify affected employees that they had a work-related contact with an individual who has tested positive for COVID-19. The rules require that the employer notify the affected employees within 24 hours of being notified about a positive COVID-19 test. And Jean will talk a little bit about what it means to come into contact with an individual who has tested positive for COVID-19. There's requirements related to testing. It states that if the OHA or another public health agency deems it necessary to conduct diagnostic testing within the workplace, then you as an employer must cooperate by making employees and space available at no cost to the employees. If you as an employer require or direct an employee to get tested for COVID-19, the employer is responsible for the cost of testing, the employee time, and the employee travel. If an employee voluntarily gets a test, not at the employer's direction, then obviously you would not be responsible for those costs under the rules. Next slide. There are requirements related to medical removal. And what this basically says is that if the OHA or a public health agency or an employee's doctor recommends that they be restricted from work due to quarantine, the worker must be directed to isolate at home and away from other non-quarantine individuals. Are you required to allow quarantine employees to work from home? Yes, if there is suitable work for them and they are physically able to do that work. So there are two kind of elements you want to meet there. There has to be suitable work, and the employee has to, have either an asymptomatic or mild case of COVID-19 that would allow them to physically do the work. You're also required to allow that person who has gone into quarantine to be able to come back to their job at the time they left, if that job is still available. The rules give some guidance on when to allow a person to return to work, and that guidance is essentially to follow the OHA and CDC guidance with respect to returning to the workplace. A negative test is not required under the rules. So you should, if you're not already, become familiar with kind of the course of the disease and when the medical professionals feel it's safe for employees to come back to work after contracting COVID-19. One little piece on that last slide is, when should a COVID-19 event be recorded on the OSHA 300 log? And that's only when the COVID-19 event was deemed to be work-related. And in this current environment, that is a very difficult thing to do. But again, if it is possible to relate the COVID-19 infection to work, then it should be recorded on your OSHA 300 log.
So can I ask a question right there? Sure. So recorded on the OSHA log. So if you determine that it is a work-related case and someone subsequently in your contact tracing identified as a close contact gets a positive test result, but has no symptoms, they don't get sick at all, the guidance from the CDC is for them to quarantine for 14 days. You pay them regular pay, quarantine for 14 days, no medical treatment. Is that 14 days of recommended quarantine considered lost time, even though it's only based on a recommendation from the CDC versus a requirement?
I think that would qualify as lost time. That would need to
be. Since you've paid them, they're not going to get time loss, because you can't.
Yeah.
You can't get both your pay and time loss.
That's right. I've actually submitted a letter of interpretation, a request for letter of interpretation from OSHA, because I have this exact situation. And I've got two. My thing is, if it doesn't cross the threshold of recordability, I didn't file a workers' comp claim, I paid them their regular wages per the CDC guidance of quarantining, then why would that go on my OSHA log? So I guess is the fact that it was just a positive test enough to say this crosses the threshold of recordability? And I don't think it is. And if I'm paying them regular wages, they're not losing any time. The quarantine time is a recommendation, not ordered by a licensed healthcare professional. It's tricky.
Well, first of all, I just want to indicate that the person whose job it is to file the claim isn't usually the employer. The employer's responsibility is to give the Form 8, the workers' comp claim form, to the employee. The employee can choose whether to file a claim or not, and then it's up to the insurance company to choose whether it's a compensable claim. And so the insurance company, or SAFE, or whoever your insurer is, will definitely investigate that and determine whether it's work-related or not. So Josh, if a claim form is filed, does that mean that you have to file reported on the OSHA 300 log?
Well, if they're days away from work and there's a positive COVID-19 test, so that means that there is whether or not they're symptomatic or not, there is an illness, work-related illness that resulted in days away from work. My recommendation would be.
Yeah, and my only argument, and the reason I've asked for the interpretation, is the days away from work was not ordered by a licensed healthcare professional. It was a guidance document from the CDC. Those are two different things, in my opinion.
Got it. For purposes of time loss, usually it has to be time loss under the workers' comp context that is recommended by a licensed healthcare person. So I see where you're saying the two things kind of overlap, and maybe the CDC guidance or the CDC recommendation that you quarantine won't be enough. But again, my take on it is that it's really not up to the employer to make that determination, and it's up to their insurer, unless you're self-insured. If you're self-insured, I totally see why you're trying to figure this out. But if you're not self-insured, your insurer is the one that's looking into all of those things, and they will accept or deny the claim. And
right. But the insurance company does not determine recordability. The employer.
That's true. That's true.
And that's my argument is I have 9 cases, no symptoms, and I've got to record all of them. When nobody got sick, nobody saw medical treatment. The only time lost was the time that was recommended as time off by the CDC. And that was a stamped, you should quarantine for 14 days on their test result. They never even saw a physician. So it's sticky, and which is why I've asked for the letter of interpretation.
Yeah, and I'd be interested to, if you do receive a response to that, I'd be interested in their position, because I think at least my interpretation is that it likely would be recordable. But yeah, if you get a different opinion, I'd be interested in that.
Okay, thank you.
Okay, so I think we can go on to Jean's slides.
And Josh, Jasmine's asked whether you can provide a link. Maybe you can send a link to Jasmine of the OSHA site that has
Yeah.
the assessment.
Yeah, I can definitely do that.
So I'm not gonna.
Yeah, I'll include that when I follow up with everyone. I'll send a recording of this and then the slides and then any relevant links. So yeah, the Word doc exposure risk. Someone was saying they're looking for it and they can't find it on the site. So that would be really helpful.
There's also, and I haven't looked at it recently. I don't know if you have, Josh, but the OSHA did have a whole section up on its website about whether an incident was recordable. And so I don't know if the prior speaker had an opportunity to take a look at that. I mean, things have happened since that was originally posted, which was at the very beginning of the COVID crisis. So I haven't looked to see whether it's changed recently or not.
October 20th, I believe, was the last. There was one that came out in May, and then there was another one that came out in October. And again, it goes through the sticking point is lost time, right? There was no medical treatment. The only thing that would have possibly made it cross the threshold would be the lost time. And the question is, if I paid them and they didn't lose any time as required by a licensed healthcare professional, it was a recommendation from the CDC. Does that cross the threshold?
Yeah, it'll be interesting to see what they say. I'd love to,
Yeah,
to see what their interpretation is. Well, I know we've talked a lot in this group, and if you've probably attended other seminars that have talked about close contact, we all know what it is. The CDC updated its website on close contact, I want to say 2 weeks ago, to change it. It used to be when we first started on this road, it was if you're within 6 feet of somebody for 10 minutes. That was the first articulation of close contact, and it was 10 minutes at a time. Then that changed to 15 minutes of close contact. And now the CDC has said that the 15 minutes, and this is just this will give you the website if you're this is the page that I'm referring to. So if you want to read more on it, you can go to this page that's referenced here. And Jasmine, can you move to the next slide? So the new definition is someone who, and this is just a quote right from that page, someone who's within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period, starting from 2 days before the illness onset, or for asymptomatic patients, 2 days prior to the first test specimen collection, until the time that the patient is isolated. So you can go to the next slide, Jasmine. What does that mean? Well, cumulative exposure, obviously, you're looking at whether, and when I've heard it articulated even more than just 5-minute exposures, this is the example given by the CDC, but I know that the OHA and also other specific counties like Clark County in Washington had this as their definition before the CDC, and they were relying on the OHA's definition. The OHA has a publication that is basically aimed at contact tracers that gave this information. And what they say is it could even be a minute here, a minute there, 15. So if you're like talking to someone for 1 minute and you do that 15 times a day, then that can be 15 cumulative minutes of close contact unless you were 6 feet apart when you were talking to the person. And the CDC doesn't care whether you're masked or not masked. So if you're within 6 feet of somebody and you have a mask on and it's still a cumulative exposure of 15 minutes, then that would still be considered close contact. So and you can go to the next slide, Jasmine. The prior print screen that I had up there that didn't just deal with critical infrastructures, that dealt with all industries. The domino effect that 15-minute close contact criteria has is really extremely detrimental to employers, because what they're saying is that even if somebody gets tested positive, so they're a positive test, then you go back and you look at who they were within close contact for 15 minutes. In the past, we've advised clients and I know a lot of large manufacturers and food manufacturers have gone ahead and had testing facilities come in and just test all the employees to see if they had, if they had a positive test, then they'd send them home. If they had a negative test, then they would get to continue working. The OHA, the CDC, and various county health departments are saying no, that you can't just judge on a negative test, because somebody could test negative day 1 and 5 days later they could test positive. So a negative test isn't going to get you out of it. What you really need to do is, if someone was in close contact with someone, then they're a presumptive person with COVID-19 and you have to have them quarantine. And then you would have to have everybody who was associated with that presumptive person quarantine. So pretty much you've got this domino effect of people quarantining, and it's going to wipe out your whole organization essentially. So that's the fear, obviously. Luckily, the CDC has this other page up, which I've also given you a print screen of there, which is, and I think this one hasn't changed a lot. I think it was always, they didn't change this after they changed the 15 minutes of cumulative exposure, but they refer to it. So it's still good law, I guess, if you will, or good policy. So this basically says that if you are a critical infrastructure employer, i.e. a manufacturer of a lot of things is a critical infrastructure employer. Jasmine, if you go to the next slide, then you may be permitted to continue work following the potential exposure. So you're not going to have to quarantine just because you were potentially exposed, provided they remain asymptomatic. Obviously, if they come down with a symptom at all, they have to go home. And additional precautions are implemented to protect them and the community. So a potential exposure obviously means being in close contact of somebody or having close contact within 6 feet of an individual with confirmed or suspected COVID-19 for a period of 48 hours before the individual becomes symptomatic. Next slide, please, Jasmine. So these are the precautions, and these are the, this shouldn't surprise you. These are the things we've been saying to do from the get-go. But what they're saying is, if you have an asymptomatic individual who may have been exposed for a minute here, a minute there, and you are a critical infrastructure employer, you don't necessarily have to send your employee home to quarantine as long as they remain asymptomatic and you do these things. So they need to, either you need to take their temperature when they're coming in, or they need to take their own temperature. And I would get something in writing from them that, they're taking their temperature and that it's normal. Regular self-monitoring, again, that's pretty much the same thing, that they're monitoring their symptoms and they don't feel sick. Wearing a mask, social distancing, and sanitizing. And those people could actually be symptomatic because, have COVID-19 and be asymptomatic. But in order to keep our critical infrastructure working, this is sort of the, what the CDC has said that we can do. On honestly, it'll be really interesting with a new administration in office to see what changes are there. And I would definitely be on the lookout for changes at the CDC to see what, whether things are going to become even more, even stricter than they already are. I don't know. Jasmine, is there another, I don't know if there's another slide that may be the last one. It is. So looking in the chat box, I think there's a few questions we have here. So our employees, so the link is there that Josh put up. And then are employees required to notify their employer if they're infected? HIPAA not required. So again, I want to emphasize to everybody that HIPAA doesn't apply to employers unless you are a healthcare provider. HIPAA is the Health Information Privacy and Protection Act. It's the thing you learn about when you go into a doctor and they have to protect your medical information. So HIPAA isn't what we're worried about as employers. We're worried about the ADA. So instead of HIPAA, let's replace that with the ADA. So our employees required to notify their employer if they're infected, and ADA not required. So I think what you're asking is, their medical information is confidential. If they're infected, the employer is going to learn from the county health department in all likelihood, because the county health department is going to, if they actually go and get a positive test, that's going to be reported to the county health department. And then the county health department will be in touch with you as an employer to begin the process of determining who is in close contact with that individual and whether they need to quarantine or not. So I hope that answered that question. Employees do have the right not to disclose confidential medical information and not to disclose a disability. The question is whether, honestly, I don't know that getting COVID-19 is a disability. A disability is not a short-term medical condition. A disability, the flu, for instance, does not fall under the definition of a disability under the ADA. So that's a whole nother issue. However, if say they got COVID and that caused their asthma to flare up and that caused some other condition that might be a disability under the ADA, then you might be looking at the ADA. But I just want to really clarify that short-term illnesses like the cold or flu are not disabilities under the ADA. So the next question in the chat box is, this is our fear, and I think we're talking about the domino effect of employees having to essentially quarantine and being left with no workers to do the work. With everything and these rules in place, people have to pass and collaborate on parts over the course of a day. And that's true. So, I've had conversations with various health departments when health departments have called my clients and said, hey, you need to, have your employees quarantine. And this was kind of before the CDC changed their definition, before the OHA came out with their definition. And some health departments were really strictly construing a close contact. But essentially the response that I got from the physicians that I talked to at the county health departments were, well, then keep them 6 feet apart. So are there ways? The question is, people have to pass and collaborate, but in collaborating, do they really have to collaborate within 6 feet of each other? And I think that's what you need to be thinking about. Are there ways that you can have people collaborate that, they can yell to each other within 6 feet, or maybe you can have things like walkie-talkies, or, they can call each other on their cell phones. So there are perhaps ways that you can kind of institute collaboration for those people that do have to talk to each other so that they're not within 6 feet. You're right. Some of you have hallways in your facilities that don't allow for 6 feet of maneuvering. And that's kind of a Josh question too. And that's why I asked that question earlier in the presentation, what do you do when you've got this one hallway? You don't have like a loop that people can do so that they can go in two directions. How do you make sure that people aren't passing within 6 feet of each other? I think that if they're passing in a hallway and they're not talking and they've got a mask on, you have no way that's not like a minute, that's like 15 seconds if it's even that. So I guess I don't think that that is what the CDC is looking for. They're looking for people who are actually like in a car together. Say you have a facility where you need to transport employees to do the work, and they do the work and they come back and there's regular transporting. You know, you really do have to be worried about those employees when they're in the car with people. That could cause a problem. Or, you know, I'm sure we can all come up with examples. But I guess the challenge for all of us is to figure out how to do our jobs and collaborate when we to give us more than 6 feet of distance, because as long as you have that 6 feet, the contact tracers, county health departments, and the CDC is not going to require your employees to quarantine. So the defense, the last line of defense is 6 feet. Let's see. Yeah, go ahead.
I've got an example of one where kind of applying the general duty clause, if you will, of the greater risk, right? So if I have something that weighs 100 pounds, I'm not going to tell one person to go lift something that weighs 100 pounds where there's no mechanical advantage. So what I've been doing is saying, okay, that is where you have to wear a face covering and a face shield for a short duration task, because the greater risk is one person trying to lift 100 pounds.
That's a really good example, and that's a really good solution. Honestly, there are going to be instances where there's no way for you to avoid 6 feet of contact. You know, I mean, the challenge is to do that, but that's a good example of why you're not going to have somebody lift a 100-pound thing by themselves, unless there is some sort of lift that you can provide that would enable the person to lift the 100-pound thing by themselves. Sometimes you just have to, you know, deal with that. But again, the other challenge I think that the CDC and health departments are going to have is how do you know whether they're within 6 feet of each other for 2 minutes here or a minute there? I mean, you might know where you have these big 6-minute intervals or a 5-minute interval, but for these little short 1-minute intervals, it's not like, unless you have all of your employees with GPS devices or RFID, something like that on them, where you can actually look and see, oh yeah, they were here together and they were here together, you will have no way of knowing. And so, you know, I think this is a challenging change to the definition. And hopefully it's not one that you all have to deal with too much, only because I just don't know how you prove it. Does anybody have any other questions for Josh or I on any topic relating to COVID or employment? OSHA, we can cover any of that with you. But this conversation was just on these, but we're here. So
I want to, I answered this question last week when I gave a similar presentation about notifying employees when they've come into contact with somebody who tested positive, and what information you as an employer are allowed and not allowed to share.
Do you want me to handle that?
Yeah.
Okay. Okay. So, I mean, the EEOC also has guidelines on some of this, because under the ADA, even though I don't believe COVID-19 for most people is going to be a disability under the ADA, still medical questions and medical information is confidential. So in terms of confidentiality of people who have COVID-19 and what you're able to share with people, you're not supposed to share their name. You're not supposed to give coworkers the name of the person who came down with COVID-19. You just say an individual. And I wouldn't even tell people if they weren't within close contact of the person. I also wouldn't tell them. I would just say to the people who've actually been within close contact, they're going to be actually notified by the county health department anyway if they were in close contact. But you were in close contact with a person who has been diagnosed with COVID-19, tested positive for COVID-19, and therefore you should quarantine if you're going to have them quarantine. If they're asymptomatic and they're a critical infrastructure person, worker, then, if they're not symptomatic, you can choose to have them stay on. But keep in mind, if they become symptomatic, then you could have maybe protected some of your other employees from that sick worker. So you really want to really decide if you're going to do that, if you're going to have somebody who was exposed but is nevertheless asymptomatic stay at work, because that could cause you even more problems if that worker becomes symptomatic. Did I answer the question, Josh? Okay. Anyone else have questions like that for Josh or I? All right, Jasmine, turning it back over to you.
Thank you. I was going to see if Kevin wanted to close out the call, but I don't see him here. So I just want to say thank you, of course, to Prosper Portland for their partnership on these calls, and we'll look forward to seeing you in a couple of weeks. Of course, thank you also to Jean and Josh. I will be following up with a recording and the slides as well. It looks like we do have one more question actually that just came in. In a workplace of 13, it's not realistic to not indicate a name, which I totally get that. Is there any legal risk to saying their name?
Yeah, I just had this question yesterday from another client, because you're right, in small workplaces, people know, everybody kind of knows. I still wouldn't say their name. Even if everybody does know, you just say one of your coworkers. If you have to tell them, obviously if somebody doesn't come into work right now, the first people, everything that everybody thinks is, oh my gosh, that person just tested positive. Then you might have a bunch of people that are freaking out. Did that person test positive? The only thing that you can do is say that, this person is home for their, home for reasons, whatever. You will be contacted if there was a positive test, and if you were in close contact with that positive test, you will be notified. Otherwise, please don't worry about it. The one thing that you can do, if you really think that disclosing their name is something that is critical, you can get a release from the employee. You can get their okay to disclose their name. I would get that in writing for sure, and just say, have them say, I don't mind you disclosing my name and saying that I tested positive for COVID-19. But absent doing that, I wouldn't disclose their name. I just give as much information, give the information obviously to the employees that absolutely need to know. They're the ones that need to quarantine. And to the other employees, I would just reassure them that if they haven't been notified by you or by the county, then they weren't in close contact with an individual with COVID-19, so they don't need to worry about what their coworkers are doing.
So the only other piece of information that I can offer up, having been through this nightmare of a workplace outbreak, and it is a nightmare, is to check with your local health department, because there are rules around, if you have this many cases, you must call them instead of waiting for the physician to report the test results and they call your employees. And for Multnomah County, at least, it was a nightmare trying to figure out who to call. It is really, really unclear. So word of caution, and we've spread it through our entire company, identify that now, so that if it happens, hopefully it won't, but if it happens, be ready, because it took hours of digging to try and figure out who to call.
And yeah, that's a good point. Believe me, I've sat on those phone lines myself trying to figure out who could answer the question or who I should give this information to. So,
yeah.
Any other questions?
Yeah, very helpful. Again, thank you both. Always so practical. Really appreciate your time, and thank you to everyone for attending today. great conversation, and we'll see you next time. Thanks, everybody.
Bye, everyone.